In the United States, the number of people aged 60 and over is expected to double between 2000 and 2040 to 80 million people. By the time they are 70 years old, more than a quarter will experience age-related cognitive decline. We know that social isolation is associated with a 50% increased risk of dementia and other serious medical conditions, according to the CDC. Right now in the US, AARP reports that more than 35% of adults aged 45 and older feel lonely. To better understand solutions to this challenge, we used the Presbyterian Villages of Michigan as a prototype test case. PVM is a faith-based, non-profit network of senior living communities that provides low-income seniors with the opportunity for independent living, assisted living, or memory care, depending on the community. How do we help the seniors of the Presbyterian Villages of Michigan care for their brain health and have more meaningful connections? We hypothesize that if we create year-round opportunities for play for seniors in the Presbyterian Village communities, then there will be increased social engagement, which will result in a greater sense of belonging and overall better brain health. To implement this, we will make physical and digital spaces specifically for play that will connect different living communities within the Presbyterian Village network. We decided to focus on play because it improves brain health through many different pathways. The social aspect of play combats loneliness, leading to lowered stress and improved social bonds. Engaging in play also strengthens cognitive function, increases physical activity, stimulates creativity, and improves mood. When we visited the village of St. Martha's, we noticed that many of the community rooms had a low capacity when adhering to COVID-19 social distancing guidelines. Many of these spaces also had minimal access to natural light and were not well connected to the outdoor facilities. An impactful intervention we could implement right now for the Presbyterian Villages of Michigan is a remote extension of the Victor's Cup, an existing yearly games competition within the Presbyterian Village network. Monthly, remote gaming events would be tracked on a simple online leaderboard, helping to connect the village's social network through digital space. Because the existing Victor's Cup is so popular, this intervention would give residents a chance to do something that they already enjoy on an ongoing platform, allowing for play and social engagement year-round. An intervention we plan for the near future and with grant funding would be a travelling fun bus that would visit each village for a limited amount of time. We plan for this fun bus to be transportable so multiple villages could share a single bus. The fun bus would be housed in a portable trailer that can fold out to create spaces for games. A ramp would make the interior accessible for activities, while openings on the sides would allow for ventilation. Side awnings would extend to create a larger shaded area. The bus would be stocked with different games that could be set up inside or outside of the trailer. In the summer, mosquito mesh panels would be attached to the awnings to keep the bugs away. In the winter months, tent walls can be added to help block wind and keep out the cold. Our FAR intervention will utilize both the physical and the digital space through an app called PVM Connect. PVM Connect is an application that can be downloaded onto a tablet or computer and acts as an online leaderboard and tracking system that can be used to measure inter-village competition. To use the app, residents will select their team and then the game they would like to play. PVM Connect starts by showing the top scorers in the game they have selected. Once they have checked the leaderboard, it's time to start. After the game is over, the residents enter their score into the database. Then to finish things off, they can submit a selfie. Residents of the Presbyterian Villages of Michigan currently lack opportunities to engage in play and social activity. Our intervention offers a cost-effective way to help seniors stay healthy and have a strong sense of belonging. By implementing this intervention, the Presbyterian Villages of Michigan would be able to keep their independent living residents independent for longer. We'd like to thank the residents and staff of the Presbyterian Villages of Michigan, Dr. Upali Nanda and the students of the fall 2021 Health by Design class, and all of the reviewers who have given feedback on this project. Thank you.